What was the prompt to the beginning of it?
That's okay. The prompt is, why does your work matter?
Okay.
Do I say hello?
Which angle should I sit?
I can do it.
Wait, where did you say to look? That one? Or this one? Okay, that one. Okay.
My work matters because I help nurture health professionals that are going to be important for the health of Nevada.
My work matters because it increases the health and well-being of individuals and communities.
Because overdose deaths are preventable deaths.
Because it provides families in the community a foundation for health through movement.
Because it helps people live safely in a chemical world.
Promotes health. What's the other one?
My work matters because it shapes the next generation of public health leaders.
Because connecting people to public health strengthens community health and well-being.
Because promoting positive youth development ensures healthy outcomes across the lifespan.
Because it promotes health, prevents disease, and protects vulnerable communities.
My work matters because everyone's health can be affected by environmental factors.
Oh. Sorry.
Expire.
My work matters because I help students navigate their educational career, which can be challenging.
Because I help future public health professionals find their path.
Because we build the knowledge, capacity, and collaboration to save lives.
Because it drives programmatic efficiency and improved outcomes for community health.
My work matters because identifying harmful environmental exposures advances maternal and child health.
I don't know, I just said.
Now? Oh.
Because it helps improve our relationships with each other.
Because more and more older people are isolated, and isolation is bad for their cognitive health.
Because it aims to deliver prevention activities and cancer care better.
Because strong systems of support make this work possible.
Because when we grow and learn, we feel vital and we feel alive. And if we feel alive, it's a life worth living.
My work matters because people are living with dementia.
I forget what it said.
That's funny because I wrote down people in need, but I think we're all.
My research matters because it informs national air quality standards to protect health.
Because it builds trust and understanding to help prevent and fight health misinformation.
Because it advances the knowledge of risks posed by chemical exposures, as well as motivates change.
Because every child deserves to be seen, to be supported, and to thrive.
Will you say that again?
Can you remind me what I said? Can you even read my handwriting? Ah!
Because it provides the tools and resources to save lives.
Because it transforms knowledge into action that saves lives through organ donation.
We have to prepare people to be able to work in public health.
Because I transform administrative complexity into clarity to allow faculty to make an impact.
Because the data is the core component of the surveillance, which is our fundamental function for population and public health.
No zombies.
Yeah.
Sorry.
Because program evaluation ensures accessible and effective public health programs and interventions.
Because it helps the school-aged children and adolescents to fight against obesity and the chronic diseases.
My work matters because care is the most elemental form of justice.
Because scientific exploration of data may lead to the finding of truth in health and medicine.
Oh, sorry.
Because it helps everyone focus on what's important.
Because every story of struggle and strength shapes community health.
Because it helps make health understandable and science touchable.
Because dementia-inclusive communities support all people in being full citizens.
Because we are working on the development of the behavioral and community health workforce through education, training, and certification.
Evaluation is important for interpreting results and improving program effectiveness.
My work matters because people matter, and their brains also matter.
Sorry, I finally got there.
Student study?
Because to improve health, people need access to the resources and information available.
Because I improve how everyone works together.
Because workforce development
and training are crucial to a strong mental health and addiction field.
Because I empower people through evidence, education, and global collaboration.
Because it serves as a bridge between research and evidence-based practice, translating all of that information into real-life changes for the community.
Because I inspire students to work with elders and build innovative partnerships in research and practice.
Oh yeah, no, I got a much better one than that.
Because no one recovers alone.
Because accreditation helps students succeed, faculty grow, and communities thrive.
Because I educate co-occurring behavioral health clinicians to serve vulnerable populations.
My work matters because it improves community health.
Because I strengthen Nevada's behavioral health workforce, bridge workforce gaps, and help communities strengthen.
Because when profit drives addiction, public health loses.
My works matter because I build connection and trust for healthier communities.
When public health works, everyone has the opportunity to thrive.
We're making health happen.
Making health happen.
This is
the School of Public Health.
Oh, shoot. That's my alarm to go to class.
It's over. That was my casting call.
You got a lot of editing, man. Please tell me you record this.
Oh, please. Guys, this is a good exercise in feeling like you do matter. Good for you guys. Good for you guys.